In terms of management, it is quite important that, for example, let's say you had a TIA, you want to promptly get treatment, because you could have a TIA within 20, another second TIA within 24 hours. It's very unpredictable. Once you've had a first TIA, there's an increased likelihood that you can have a second TIA. So, you don't want to stay at home and wait a few days till you see your doctor because your doctor's surgery is closed. I would normally recommend going to hospital, because getting yourself checked out, getting yourself examined, because they can arrange for you to have tests. You can have some blood tests, check cholesterol, blood sugars, check your blood pressure, check your full blood count, your platelets, your clotting factors, all the risk factors that they will check. Have your blood pressure checked as well. Depending on if you still have symptoms, whether it's a stroke or TIA, they might arrange for you to have an urgent brain scan, of the brain, looking for, any causes like blood clots, like we spoke about, that can cause strokes, and looking for where exactly in the brain the stroke is, because that would also determine your prognosis and treatment, and it also tells you what symptoms, why you're having the symptoms that you're having. Like I said, different parts of the brain control different body functions, and it can also reveal that you might have had previous strokes in the past which you never knew about. So you could have what we call acute lesions in the brain. They look like all these little white dots in the brain, and the radiologist or whoever's looking at the scan can tell acute means new, if there's a new, or if you've had old lesions. There are brain scans that when you look at them, it says multiple old infarcts. An infarct is lack of dead white matter in the brain. That's what an infarct is, which is usually due to lack of blood supply. So some scans will say multiple old infarcts in the brain. That means you've had several strokes which you knew or probably did not know about. Especially for TIAs, they will do a carotid, well, you got your carotid artery, which is responsible for blood flow, and is one of the most common causes of TIAs if it's blocked. So they will probably do an ultrasound to look at the blood flow to see if it's being disrupted as well. Or other investigations they will do. So brain scan, blood test, next scan are the most important tests that needs to be done. But prevention, again, is very important. In terms of prevention, you were talking about medications like blood, medications that reduce, that thin the blood, like your aspirin and clopidogrel. Aspirin, again, has been replaced by medications like clopidogrel, dipyridamole. In some cases, they give warfarin, depending on, other conditions going on, like if you had DVT or atrial fibrillation, they'll give you warfarin, which is like rat poison. But don't worry, the dose that you're given is not the rat poison dose. So these medications, some people are both aspirin and clopidogrel for a long time. Clopidogrel is usually lifelong. Aspirin, they might stop after a while and say just continue on the clopidogrel. Then, even though your blood pressure might be normal, they might still give you blood pressure tablets, because we're talking about optimum control. So keeping that blood pressure at the optimum level, at where it's not going to increase or cause a risk of a further strokes. They might give you cholesterol medication, even though, again, your cholesterol might be normal. So normal cholesterol is more than 5, but they might say, look, we need to be aggressive with this. Let's keep your cholesterol less than 4. So you'll be on cholesterol medication. So you'll be on all sorts. Again, they might also give you medication to protect your tummy, like omeprazole or lansoprazole, because if you're on 2 tablets like aspirin and clopidogrel, that can cause damage to the lining of the stomach, which can cause blood in your stools, stomach pains. You're at risk of ulcers as well. So there are side effects, with some of these medications. And you should be reviewed by your doctor to make sure that you should continue with these medications, that you're not having any side effects, or if medications needs to be increased, then you need to do your own part. You need to make sure that you're checking your blood pressure all the time. You need to make sure that your diet is okay. You're not taking foods that's going to increase your cholesterol levels, for instance. If you're diabetic, because people who are diabetic have increased risk of strokes as well. I didn't mention that as a possible cause. So being diabetic, you can, is another risk factor. So bringing that blood sugar down, is very important. Making sure you do some form of exercise. I know some people would say, look, I'm too old to exercise. I'm 80 now, or they might say, I've got knee problems, I've got back problems. When we talk about exercise, we're not talking about going to run in a treadmill. If you can do that, that's fine. But, exercise, just simple going for walks in your garden is a form of exercise, or going for walks in the park, outdoors, slow walks. You don't have to jog or run or do anything, but according to your activity, when you're 80 or something, just, a walk, makes a world of difference. Better than sitting home, all day, for instance. And then if you're a smoker, you want to stop smoking, you want to reduce your alcohol intake as well. So this, you want to lose weight. These are all risk factors that, need to be controlled. Obviously, if you're someone who had a major stroke, you would have what we call stroke rehabilitation. You know, people like your physiotherapist, because you have to learn to walk again, you have to learn to do certain activities again, move your arms and limbs. So physiotherapist who specializes in stroke will help you in that aspect of it. Then you've got occupational therapists as well, because after a stroke, it can take some people 18 months to recover, or even longer than that. So if you're due to go back home, you need an occupational therapist, because they need to look at what adaptations you might need in the house. You might need changes to your bathroom. Maybe if you might need handrails to go up the stairs, or you might need some form of stair lifts, to go up the stairs. If you're unable to walk, they will look at your independence levels as well. Some people need carers going back, because after a stroke they're not the same. They might need carers. They might need what we call a hoist, which is used to transfer you, especially if you're heavy. Carers trying to carry you, they're causing themselves at risk, and they're causing you at risk as well if they drop you by accident. So a hoist is usually in the house that can be used to do lifting. So there are other, then there's meals to think about as well, like who's going to make your meals. So there is a lot of planning that has to be done when you have a stroke. It's not a case of just take medication and bang, you're done. Your independence have to be assessed, like, because can you do the same activities of daily living that you used to be able to do, before you had a stroke. And then we talked about a TIA. A TIA can increases your chances of having a stroke. So if you have a TIA, you really have to reflect and change your lifestyle, because a TIA is a warning sign that something is about to happen. And like I said, there's no warning. Some people, there's no warning sign. It can just happen out of the blue. And even though we talked about risk factors and causes, some people actually have this for no reason. They have all the investigations and nothing is found. So a lot of times, a lot of stuff can happen, without you having any predisposing factors like high blood pressure, high cholesterol, high blood sugars. There's no family history. There's nothing. You just had a stroke. Also, women, bear in mind, being on the combined contraceptive pill can also increase your risk of having a stroke. So before you go on the combined contraceptive pill, your doctor should be taking a good history, looking at family history, looking at if you have any history of like previous blood clots, maybe doing a blood test to make sure you don't have any problems with your clotting, checking your blood pressure, checking your weight, because we need to reduce your risk factors of having a stroke if you're on the combined, contraceptive pill. So I think this is all I can say, regarding, strokes. If you have any questions that you feel you need to ask, you can, drop some comments down below, and have a good day.